Hey everyone, I hope you're all well. It's day 12 post-op and it's a Monday. Never miss a Monday. Well, I'll be missing a Monday and for the next few weeks as well, so you'll have to do it for me. I'm back at work today, so day 12 back at work, albeit coining a new phrase of working from my bed, because it's the comfiest place to work, to be honest. There is absolutely no way on this earth I would be able to actually go out and do my job properly, which involves lots of driving, going to different sites, seeing different clients. I just couldn't do that at the moment. There is no way. I can't drive, but also I can't walk very far. So if you're planning on having corrective surgery, you really need to factor this in. I'm so lucky that I work for the most amazing company who are fully supportive of me doing this and have given me the opportunity to work from home for the next few weeks. And that means that I can, do all the things that I need to do to keep work ticking over, but not put pressure on myself or my body. And I'm immensely grateful for that. So yeah, back to it. It's been good, not too stressful, just catching up with what's going on. I'm sure the stresses will kick in as the week progresses, but we'll see. On the eating front, I have been, for the last 12 days, not worrying at all about what I eat, not tracking, not panicking about calories or macros. I've literally just been listening to my body and eating what I felt I needed. And it's been relatively clean most of the time. I had some milk chocolate rice cakes while I was in hospital. I had some birthday cake over the weekend because it was my daughter's birthday. But, I've not been going crazy mad on eating whatever I want. However, today I've decided that I'm going to start back on tracking. I'm not worrying about macros just yet because that's, a bit of a stress in itself. But I've set myself a calorie target and I am tracking against that calorie target because I don't want to put weight on, realistically. While I'm sitting around doing nothing, it would be quite easy to. However, my surgeon did tell me, and lots of other people have told me, that your body does burn lots of calories while you're healing. So I'm not overly worried about it, but I just want to make sure that I'm in control. And during these next few weeks where it would be quite easy to kind of reach for chocolate while I'm at home, I'm not going to do that. One of the things I have noticed is how little I can eat before I feel absolutely full up and like I'm going to pop. And that's probably because the skin is pulled so tight at the moment that there isn't much room for food. So rather than having 3 large meals a day, which is kind of the old body coach way and what us leaners are used to, huge portions, it's now more about smaller meals but more often, because that's kind of the only way that I can do it at the moment. So it's adjusting to what my body can take and what I feel like, but keeping that now within a calorie framework so that I don't go out of control. But the good news is today, feeling much less swollen, so it's nowhere near where it needs to be yet, but from the side view, much less swollen. And this is a size 10, and there's loads of room in it, so it's coming in here, which is great. Legs are getting back to normal, so I'm starting to see my thigh gap again, so it's good. And I'm feeling a little bit more energetic, the walking isn't taking it out of me as much. I can walk around the house a little bit more and, not be needed to stop. So it's great. I made my own lunch today. I made myself poached eggs and spinach on rye toast without any problems at all. So it's good. And from a pain perspective, the pain's really subsiding now. So, unless I move particularly badly, then I can sit comfortably and not be feeling pain. So lots of thumbs up today. Did have a funny moment this morning, so I decided that I wanted to lie flatter in bed last night. So just laid on 2 pillows with 1 pillow underneath my knees. But this morning I couldn't sit up on my own because I can't use the muscles to pull myself up, and I couldn't get a grip on the bed with my hands. So yeah, that was a bit of a scary moment, and just reminded me that, you know, I'm not as far forward as perhaps I think I am in my head. There's still a lot of repairing that needs to be done. And I guess that brings me to the next stage of the journey. So for me, it's all going to be about getting prepared to see the scar. Because to be quite honest with you, I've kind of avoided that up until now. I had my dressings changed with the nurse last week. Didn't really look. And they're covered in dressings now, which in the mirror look perfectly fine because they're just lovely white strip dressings and you can't see anything that lies beneath. But next week I'm going to be taking those off, and that's the realisation that you've got a massive shark bite that goes from hip to hip. That is going to take some getting used to, I think. So I'm starting to mentally prepare myself for that. I have to wait until the scar is fully healed before I can start doing anything by way of treatment. But I have got this, which I've shown you before if you watch all the time. But this is Dermatix silicone gel, which I'll be using alongside coconut oil to reduce the appearance of the scar. And a lot of the scars that I've seen sort of 6 months down the line are just a nice white, flat, silvery line. So that's what my aim is to get, you know, this big angry red scar, which I'm bound to have when I see it next week, and turn that into something nice and flat and white, so that you can barely see it. And hopefully in a year's time my shark bite will be something that's, you know, hardly visible. We will see. But I'm staying positive about it because that's what you've got to do. And, you know, although I'll have this massive scar across my tummy, I'm going to have a flat tummy. I'm not going to be seeing the loose skin. I'm not going to be tucking it into my jeans. It's going to be gone, and it has gone, and that's just incredible. So that's my message for today. We'll see what tomorrow brings. You know, every day is getting better and better, and I just got to keep going, haven't I? So I'll speak to you then. Have a lovely evening. Take care.